Airlines has cut back on their flight schedule because demand is falling. Corporate travel is dropping. Recreational travel is dropping. People are asking themselves, should I be taking this trip? Should I be going to the airport? I'm supposed to fly tomorrow. How do you feel about people and members of your family going to airports in America and getting on planes in the middle of this public health crisis?
Well, ironically, going to the airport and getting on planes may be one of your safest public locations, because the airlines have been working with the unions and the people who know how to address these things for the last 2 months, because we actually fly around the world and have been dealing with coronavirus for the last 2 months. But what I would tell you is that this is incredibly serious, and the words that have come from the White House put both my members and the traveling public in harm's way, because we're not getting the tests to the right people to be able to contain and identify where we have the community outbreaks and where we can isolate that now that it's in the United States. And that puts us all at risk. It also puts us at risk for giving good information to the public about what they can do to protect themselves. But I will tell you that the airlines have worked very closely with us. I can think back to the Ebola crisis, and I was actually at the White House with Ron Klain in several meetings with other union leaders, with industry leaders. We were all at the table. He brought an interagency working group together, and we were not only talking about what we needed to do on the front lines to have the right supplies and the good information to be able to contain this in our workplaces, and for those of us who are on the front lines, flight attendants, nurses, teachers, but also what we were going to do as Americans to actually go to the infected regions and help contain the diseases there. Here, we can't even talk here about what we can do in a coordinated way with good information in this country to be able to contain this. And so I can't even believe where we are today, and I'm extremely disheartened that the President of the United States is putting my members at risk, my members' jobs at risk, our entire economy at risk, and not taking this seriously. And we're not even getting to the space that we should be in, where we should be coordinating through the White House with all the local healthcare professionals and the healthcare community, and with all the people on the front lines to have a very deliberate response to this. We can take this on as Americans, but not with this kind of chaos from the White House.
Sara, we are all washing our hands furiously all day. What are the airlines doing in terms of trying to sanitize the aircraft themselves between flights? Are they taking extra measures in cleaning the planes?
The airlines have been interacting with us, and there are issues because there has been contracted out work with the cleaners. So there is a supply chain issue there and coordination, but the airlines are working very hard on making sure that they are taking deliberate measures to do extra cleaning, follow CDC guidelines on that cleaning, and they have been interfacing with us on that. They also have been coordinating and trying to get bulk hand sanitizer near the galleys and the lavatories, and coordinating with us on that, but it does require a government approval or exemption to be able to put that bulk hand sanitizer on the planes. So there are issues that should be done very quickly through the coordination of private and public partnerships, but there's no coordination coming from the government to help these things move along. Very simple, good ideas that if we had someone who was able to coordinate this, we could move faster, we could help to mitigate the spread of this disease, and we could get the proper tools into the hands of the people who are first responders.
Dr. Gonder, what